All right, let's dive right into this explainer. Today, we're going to permanently untangle HIV and AIDS by tracing the exact step-by-step clinical progression from the very first moment of infection all the way to advanced disease. For decades now, you've probably heard these terms used completely interchangeably, but medically speaking, they are absolutely different things. So we're going to look closely at the data and clearly map out this biological journey.
So we're kicking things off with a huge question, one that honestly causes a ton of widespread confusion. Are HIV and AIDS actually the exact same thing? If you ask the average person on the street, you'd probably get a yes. And it's a super easy assumption to make, right? Because they're inextricably linked. But treating them as synonyms totally obscures the medical reality of how the human body actually interacts with this specific pathogen over time.
Well, to answer that, we really just need to look at cause and effect. HIV is the literal virus. It's the cause. AIDS, on the other hand, is the resulting syndrome, the effect. Think of it as a very strict cause and effect relationship. You simply cannot have the effect without the cause. But, and this is key, having the cause doesn't mean you immediately or inevitably experience the effect. They're two completely distinct points on a clinical spectrum.
Okay, moving into section 1, the virus versus the syndrome, let's establish our baseline.
By definition, HIV, which stands for Human Immunodeficiency Virus, is the actual physical virus. It's this microscopic invader that gets into the body and actively targets and wipes out your immune system's CD4 T cells. Think of these T cells as the generals of your immune system. They're the white blood cells whose entire job is to coordinate your body's defense against infections. HIV specifically hunts down these vital cells, enters them, uses them to replicate itself, and then absolutely destroys them in the process.
Now, in stark contrast, AIDS, Acquired Immunodeficiency Syndrome, is not a virus at all. It's a late-stage condition or syndrome that only happens after the immune system has been severely damaged by the prolonged presence of HIV. Notice that word acquired. It's a syndrome you acquire only because the virus has successfully broken down your cellular defenses over a long period. You don't catch AIDS, right? You catch HIV, and without any medical intervention, it can progress into the syndrome known as AIDS.
Right, let's look at how this builds chronologically in Section 2, Stage 1, Acute Infection. This is all about the initial invader. Looking at the big picture of how this disease progresses, this acute stage hits fast, usually just 2 to 4 weeks after someone is initially exposed. It's a super short window at the very beginning of the journey, way before any sort of chronic infection sets in. It's basically the body's rapid, immediate panic response.
During those first couple of weeks, the virus is just multiplying like crazy in what's essentially a hostile takeover of the body. And this massive viral replication triggers some pretty severe flu-like symptoms because the body is desperately trying to mount a defense. Patients often experience intense fevers, severe night sweats, deep muscle aches, and just extreme fatigue. But here's the tricky part. Because these symptoms perfectly mimic common bugs like the flu or mono, this highly infectious acute stage is frequently misdiagnosed, or even just totally brushed off by the patient.
Once those initial symptoms fade, we enter Section 3, Stage 2, chronic infection, also known clinically as the latency phase. So here's the really crucial part. Even though a person might feel 100% fine, the fever's gone, the aches have totally stopped, the virus hasn't left. It is still secretly multiplying and slowly depleting the immune system. This is what we call clinical latency. It's literally a silent war. To the outside world, and even to the person who is infected, everything seems perfectly, completely normal. But internally, HIV is systematically destroying those CD4 T cells day by day, month by month.
And zooming out on our timeline, this quiet, asymptomatic phase can actually last for a decade or more if it goes untreated. 10+ years of the virus just quietly chipping away at the immune system's foundation. This incredibly long time frame is exactly why routine screening is so absolutely vital. Without testing, someone could be in this chronic phase for a full decade, entirely unaware of their status, while their internal defenses are just being steadily dismantled. Eventually, without medical help, those defenses run out. That brings us to Section 4, the clinical tipping point, where we cross the immune threshold.
This specific tipping point happens the exact moment a patient's CD4 count plummets below 200 cells per cubic millimeter. In the medical world, 200 is an absolute dividing line. Below this number, the immune system is essentially non-functional against your daily environment.
To really wrap our heads around how devastating a count below 200 actually is, it helps to know what normal looks like. A healthy, uninfected immune system usually operates with anywhere from 500 to 1,600 of these CD4 cells per cubic millimeter. So by the time a patient hits that 200 mark, they've lost well over half and potentially up to nearly 90% of their primary immune defense network. The fortress walls haven't just been breached, they have been completely leveled.
Once that absolute numerical threshold is crossed, we hit Section 5, Stage 3, AIDS diagnosis. This is where the syndrome fully manifests.
An official AIDS diagnosis is medically confirmed when a patient meets some very specific criteria, either hitting that critically low cell count of under 200 or by the sudden presence of what we call opportunistic infections. Now, what are opportunistic infections? They're exactly what they sound like: infections or cancers that take opportunity of a completely destroyed immune system. These are everyday illnesses that a healthy body with 500 to 1,600 CD4 cells would fight off with zero issue, often without you even noticing. But in a body where HIV has depleted the CD4 count past that breaking point, these everyday pathogens literally become life-threatening. And that right there is the true hallmark of acquired immunodeficiency syndrome.
Now that we've mapped all this out, let's talk about Section 6, why this knowledge matters, specifically regarding testing, treatment, and stigma.
Understanding this step-by-step timeline is a total game changer. It practically empowers people to get tested early, and it allows doctors to promptly start modern antiretroviral treatments. And honestly, these treatments are nothing short of miraculous. They can completely halt the virus in its tracks, which means a person living with HIV may never, ever progress to AIDS and can live a completely full, normal lifespan. On top of that, mapping this out dismantles a lot of harmful societal stigmas. When we use clear, scientific facts to explain the difference between a manageable virus and an advanced syndrome, we replace fear with actual understanding.
So I'm going to leave you with this final provocative thought to chew on. How does understanding this precise clinical timeline change how we fight the virus and actually support the people affected by it? Because when we really understand the mechanics of the enemy, we don't just treat the disease better, we treat people better. Thanks so much for joining me for this explainer. Keep asking questions, and I'll see you next time.